everyone. Today let's begin with the discussion of another MCQ. Okay, the question is a critically ill patient was given an infusion of an intravenous anesthetic drug at the dose of 4 milligram per kg per hour. 48 hours later, the patient developed refractory bradycardia and there was evidence of rhabdomyolysis on investigation. So, which of the following anesthetic drug is implicated in this case? Option number 1 ketamine, 2 etomidate, and option number 3 called propofol, and fourth one is thiopentone. Okay, so now a critically ill patient was given intravenous anesthetic drug at the rate of, that is, the dose is 4 milligram per kg per hour. Okay, later means after 48 hours patient developed refractory bradycardia and on investigation shows rhabdomyolysis. So these features points towards the a rare condition called propofol infusion syndrome. It is a rare but lethal syndrome is seen when anesthetic drug propofol is given at the dose more than 4 milligram per kg per hour for 48 hours or longer. And this infusion syndrome is common in children and a critically ill patient. Here the patient is a critically ill patient, so we can suspect this propofol infusion syndrome in this patient. Okay, so the important clinical features of this condition is a refractory bradycardia which is leading to the asystole in the presence of one or more of following condition, means acute refractory bradycardia along with some other features will be there. What are those? First one is rhabdomyolysis. Okay, next metabolic acidosis. Okay, and hyperlipidemia, elevated cholesterol levels, enlarged or fatty liver. Okay, so these conditions are associated with acute refractory bradycardia which is leading to asystole. Some of the other features like acute cardiac failure, hyperkalemia, okay, all these are seen with this, and even cardiomyopathy. These are the some of the other features associated with propofol infusion syndrome. Okay, so these all these features occurs due to the release of intracellular contents. Okay, it is mainly defect in the mitochondrial metabolism and defect in the electron transport chain. Because of this, okay, all the symptoms and sign of this propofol infusion syndrome occurs. Mainly it is due to mitochondrial metabolism and electron transport chain dysfunction. So other options, ketamine, you already know that this drug produces dissociative anesthesia. Okay, etomidate, it produces adrenocortical suppression, and thiopentone sodium, it is a barbiturate group of anesthetic drug, and this drug releases histamine. Okay, and so this thiopentone sodium is avoided in asthmatic patient because of release of histamine. It aggravates the bronchial asthma condition. So among these four options, propofol is the most likely anesthetic drug implicated in this case, and this condition is called propofol infusion syndrome. So answer is C, propofol. Thank you all.